At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.
Good afternoon and welcome to our latest Let's Talk Children's Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS Children's, thank you for joining us. The well-being of our children is essential to building a healthier future for our community. So prioritizing their health and happiness is paramount. Ensuring they receive the necessary medical attention from an early age, including regular health checkups and screenings, sets the foundation for a lifetime of healthy living. So to help parents prioritize their children's health, STHS Children's hosts these Let's Talk Children's Health webinars by providing education on health issues affecting kids right here in our communities. Parents can help maintain their children's overall well-being. In this installment, we'll be talking about the dangers of vaping. E-cigarettes are the most used tobacco product among youth in the United States per the CDC, with more than 1 million students currently using vapes as they're called. More than 400,000 of those students are in middle school, while 7% are in high school. Now, most e-cigarettes contain nicotine, a highly addictive organic compound found in tobacco that can harm parts of an adolescent's brain that control attention, learning, mood, and impulse control. So to talk about the dangers of vaping, we're joined by respiratory therapist Mary Lopez, the Director of Respiratory Therapy at STHS McAllen. Mary, thank you so much for joining us.
You're welcome.
Now, first of all, you have 42 years of experience as a respiratory therapist. I know back in the day we were talking about the dangers of smoking and how dangerous smoking was. And I think people may have a false perception that vaping is not dangerous.
It is very dangerous. It's not considered as dangerous as smoking, but it's still very dangerous. There's not enough studies out there, or it's been going on long enough for them to have any real data to compare both.
But in the hospital setting, you're in the hospital setting, you're in an acute setting. Basically, people are coming in here with serious health issues. They're not going to their doctor with some wheezing. You're seeing the worst of the worst cases.
Correct.
Are you seeing more teenagers coming in?
Yes, we are.
And what kind of condition are you finding them in?
A lot of them come in with like a dry cough and dry throat because of the vaping and the e-cigarettes. So they're having all these symptoms of having some kind of a cold or a flu. But in reality, it's not. It's more because of the vaping, so they have that dry, naggy cough.
Mm-hmm. And then when it comes to treating that, because obviously the lungs are very sensitive, so how do you tackle a case, especially a severe case, to help sort of kids get their lung health back?
A lot of times what you want to do is you treat them with oxygen. If they're that severe, you start treating them with oxygen. And you'll start with a little bit of a low flow oxygen, which is like maybe 2 liters, just to keep their oxygen levels at a normal level. And if it's progressive more, you're going to have to increase the type of oxygen that you're going to be using. And it can lead up to ventilation. So that means putting a tube down your throat and using this machine that's going to help you breathe throughout the process.
So when we're talking to teenagers and to parents of teenagers and children, because they're even in middle school, it's important for them to realize that this can have some serious impact on your overall health long term. And you're only in your teens. So imagine you have an entire lifetime to live and you're going to be dealing with lung issues if you're not careful.
Correct. So it will manifest later on in life. Again, like I said, there's not a long-term study, but there is more use of it, so people are starting to see more complications with it, as to where, like I said, it would lead up to maybe intubation and ventilation with, in the ICUs.
Mm-hmm. And you have a great presentation for us, so let's get started.
Sure. Okay, so the Cleveland Clinic vaping is when you use a handheld electronic device to breathe the mist vapor into your lungs. Electronic vape devices include e-cigarettes, vape pens, electronic nicotine delivery systems. E-cigarettes are marketed as a less harmful alternative to cigarettes, but no tobacco product is safe, especially for children. Most e-cigarettes contain nicotine, but some can also be used to deliver cannabis and other drugs. Some vaping statistics. CDC, more than 1 million students are currently using e-cigarettes. More than 400,000 of those students are in middle school. The FDA says 26% of current use e-cigarettes users use a vape product daily. FDA, more than 8 to 10 current youth vape users use flavored e-cigarettes, with fruit flavors being the most popular. The FDA also states the most commonly used device among current youth e-cigarette users was disposable, followed by pre-filled refillable pods or cartridges. The risk of vaping. Brain development can be affected, lungs and other organs can be damaged, increase the risk of cardiovascular, respiratory, gastrointestinal disorders, causes breathing problems, addiction, nicotine dependence, irritation of the mouth and airways, chest pain and palpitations, and dehydration. Tips to quit vaping. Set a quit date. Identify alternative coping skills. Get rid of vaping products. Gum, candies, toothpicks, and other items can help fight the urge to vape. Help your teen get professional help. Tips to prevent vaping. Maintain a dialogue about the risk of vaping. Prepare your kids for peer pressure. Set a good example. Establish a smoke-free home.
All right, so that is some really important information. I think it's important for parents to really understand, and teenagers also should be watching this and really understanding the dangers of vaping. But let's talk a little bit now about just how sensitive are the lungs.
The lungs are very sensitive just to any kind of irritant, not just smoking and vaping, just like it is to dust. So you're going to have some effects of it as soon as you start doing it. You probably start with a little bit of cough, just some tickles in the back of your throat, but you will start getting some effects immediately.
And what kind of things, when you see with the lungs, in terms of the damage that you start seeing, what are those initial signs that you're starting to deal with some health issues related to the lungs?
A lot of times they present as like having a common cold or a flu-like symptoms into the hospital, and they end up with a pneumonia, okay? And so that's how it manifests, as a pneumonia. And when they go in to do some types of studies, let's say for instance a bronchoscopy, where they put a tube down your throat into your lungs, they're finding that there's no infection. So that's been caused by the e-cigarettes or the vaping.
Mm-hmm. And when it comes to the lungs, I know we talk about the liver, and the liver can sort of heal itself a little bit. Obviously, there are some things that can cause long-term damage, but for the most part, it sort of can heal itself. But the lungs, once you damage them forever.
Right, it's pretty much so. If you start damaging your lungs at a young age, it's going to start happening. And if you continue to smoke or do vaping or e-cigarettes, the damage is going to continue to where you will end up with some very serious health issues down the line. You may end up with having a stroke, a heart attack, some kind of vascular disease along the way.
Mm-hmm. What is the youngest age that you've treated yourself that you can remember when it came to a child or a teen that was vaping?
I would say about 13 or 14.
So that is a really young age. We're seeing kids basically coming in. They're not old enough to vote yet. They're not old enough to drink, but they're coming in with vaping issues.
Correct.
Mm-hmm. Now, no tobacco product, including e-cigarettes, is safe. I think that's really important. Why is nicotine so dangerous?
It's addictive. The chemicals that they use in the nicotine is very addictive. And the same thing happens with the e-cigarettes and the vaping. It's the chemicals that they use that makes it an addictive product. And
we're talking about, in e-cigarettes, we were talking about the different things that you can find in them. So there was tin, nickel. So these are very serious chemicals that can cause some serious damage to those lungs.
To the lungs. And there's a lot of chemicals in them, or what we call food products, or things that we can actually eat, but they're putting into the chemicals, are part of the chemicals that they're using for the e-cigarettes and the vaping oils. And those are not to be smoked. Those are actually just to be eaten. And those irritants are going into your lungs.
Okay. And I know that when we talk about e-cigarettes, there are different types of brands that are out there and different types of sort of vape pens, but basically all of them are dangerous.
Correct. All of them are dangerous. It doesn't matter which one it is.
And then are there some, what are the differences in vape pens that you see? Like some obviously have where it has a cartridge, right, with the chemical, and then you just put a mouthpiece to it. And
Correct.
others are actually kind of burning on the inside. Is that right?
Yes. Some of them do burn on the inside. I really haven't seen too, I mean, I don't vape, so I don't know exactly what type of products are out there, but I have seen that some of them are cartridges and they have like a little mouthpiece to it, and people will just kind of hide it within their hand itself, so you don't know what they're doing. You know, you just see them kind of going up to their mouth and they're vaping. And then, of course, the e-cigarettes, I'm assuming, is just like a regular cigarette.
And but the bottom line is that no matter how you're inhaling those products into your lungs, you're still causing some damage.
Correct.
Now let's talk a little bit about, once again, the side effects that we see from vaping. So there's obviously coughing. So you see a lot of that, right?
Right.
And what is it? It's just that it's irritating the lungs, right?
It's irritating your airway. It's what it's doing. The warmth, I'm assuming it's the warmth of the vaping. It's irritating your airway, so that's what's making you cough. Because there's something foreign going into your airways and into your lungs.
Okay.
So if anything foreign goes into your body, you're going to react in one way or in the other. And that would be the way the body would react, would be by coughing. Okay.
Shortness of breath is another one that you're going to experience. And that's really just because you're causing that damage to the lungs. So you're not able to just breathe as well as you could.
Correct. And it's just like when you're a smoker and you have smoking issues like what we call COPD, chronic lung disease, you start getting short of breath because your lungs, your airways are not working like they're supposed to be. So you're going to start asking for air. And that's the same thing. That's the same thing that happens with the e-cigarettes and the vaping. You'll start getting the damage to the lungs and becoming short of breath.
And there are a lot of teenagers that are involved in sports, whether it's their high school or their middle school programs that they're in, or the community ones that they do. And that you can be fully healthy, you can be lifting weights, be really fit, but be experiencing that shortness of breath. That's something that a parent might notice. You know what? I noticed that my kid isn't able to run as well as they used to, things like that, right?
Correct. Yes, those are some of the symptoms. If the parent does not know that the child is vaping or doing the e-cigarettes, they're going to start noticing something somewhere down the line because it's not going to be normal for them.
Now, eye irritation is something else that you're going to see because obviously you're also dealing with the smoke that's caused by the vapes.
Yes, you will see some redness into the eyes and so forth. It's just like, I guess, if smoke hits you automatically when you walk out, you get dusty or whatever, your eyes get irritated. It's something that's entering your body that shouldn't be there, so you're going to react one way or another.
You're going to see headaches. That's another issue that you're going to get. And headaches can be caused by the smoking, the vaping, anything that involves nicotine can cause the headaches.
Also because it could cause high blood pressure, and high blood pressure does cause headaches.
And then you have the dry and irritated mouth and throat, which you were talking about. So you're kind of starting to feel like they're drinking a lot of water, or they're extra thirsty when they normally wouldn't drink as much water.
Right, you're going to start seeing things like that happen. They're going to act a little abnormal when it comes to drinking water and so forth.
And another telltale sign is nausea. So if you're starting to feel like you need to vomit, that's another, that may be a telltale sign.
A decrease of appetite because of the nausea, maybe a little bit loss of weight also.
All right. Now, vaping has also been associated with not just your physical health, but also your mental health. There are links to depression and other issues when it comes to vaping. And it's, I think, very similar to smoking. We have to also be thinking about our mental health, right?
Correct. Yes, we do. Because our body just acts so differently and reacts so differently, like I keep saying, because it's something foreign. So some people think it's just normal and they want to kind of relax. So start. They may already have a problem or an issue or concern with their mental health, and they're thinking they're getting better or relief by vaping, and it's actually manifesting it.
I know we've talked a lot for years about the dangers of smoking. It's on the labels. There were commercials about it growing up. It's always been something that we've really talked about. But when it comes to vaping, I think it's attractive to kids because you see all of those flavors that they have now. So you're getting like cinnamon, vanilla, or so many different flavors. But those flavors can also be really dangerous, correct?
Correct, they can be.
What are the issues with the flavoring?
The flavoring is also by the chemicals that they're using, like we spoke about earlier. Sometimes they use some tin, some different kind of chemicals in there that it's causing it. that shouldn't be there. It's not all natural. It's more of a synthetic type of thing.
And then some of those that where it may be natural, it's something that you're okay to eat, like certain flavors you can eat, but inhaling it, what is it about inhaling it that makes it so damaging?
It doesn't belong. It's not made for you to eat. It's, you know, it's an airway. So if you think about it, our airway is always open because we continue to breathe.
Yeah.
Our esophagus where we eat is closed because it's not always in there. So that's the way to look at it. It shouldn't be in there.
Yeah.
Okay.
So just making sure that you're paying attention, that you're constantly breathing,
Right.
you're not constantly eating.
Right, that's one way of putting it.
Yeah, so you got to make sure that you're
Right.
that these flavors, that even if it sounds really exciting, it still is very dangerous.
Correct.
Now let's talk about the length of, when it comes to the time spent vaping, it tends to be much longer than smoking. So it says here that it takes about 2 to 5 minutes to smoke a cigarette. On the other hand, e-cigarettes can last up to 20 minutes. So normally you'll hear about people taking a quick smoke break. They'll smoke for 2 to 4 minutes or so. But vaping is something that you don't know how long you're doing it. You could be vaping for 20 minutes out on a break.
Yeah, you could be vaping out there, and that's where the addiction comes in, the nicotine and the irritants and all the chemicals, because you don't know exactly how long you're vaping for during this whole time.
You're not really like tracking it
You're
like
not
you do.
tracking
Like, you know, I've had a pack of cigarettes this week. You're able to tell. But when
Correct.
it comes to vaping, you're not really paying attention to
No.
the number of cartridges or just even how long you're inhaling.
Correct.
When you're doing something like that, especially as a respiratory therapist, when you're obviously smoking for 2 minutes, you're inhaling, but 20 minutes is a huge difference when it comes to the damage of
Yes.
inhaling into your lungs.
It is. It does that big difference because of the length of the time.
And I know that kids aren't paying attention like adults do when it comes to their activity time or whatever. We're watching our clocks. We have to get back to the office or
Right.
whatever. But kids aren't really on that kind of schedule yet.
No, it's more. I think the kids are more on like let's see who can do it the longest type of thing. The cool thing. It's compete. It's like a little competition. You know, who can do this longer than I can. I think that's what the mentality a lot of them have.
Now, it can also affect brain development. So obviously, their brains are forming. They're at a young age. Our brains are still forming. I want to say that it's not until you're into, like, I want to say your early 20s when your brain is fully formed. So
Correct.
you are causing damage to your brain by vaping.
Right, because you're still developing, and it's not. What it does with the vaping is just like smoking. Your vessels get constricted, so you're not going to have the good blood flow that you normally would have. So not having the proper blood flow to your brain is going to damage it in some way or another, or it would slow down your development.
Now, we've talked about stroke as being a disease that sort of affects an older generation. It tends to be older Americans that experience strokes. But have you seen that strokes are happening in teenagers and in
Yes.
young adults because of these issues that we have with vaping?
We have seen a few of those, yes.
And heart disease is another one. So stroke and heart disease are two diseases that kind of you hear about often. They're the leading cause of death in our country, and we're seeing young kids getting
Now we're
them.
seeing a lot of young kids get that, yes. And it probably is caused by the vaping or the e-cigarettes.
And that's just all of that wear and tear that you're putting on your body that you shouldn't be from inhaling all of
Correct.
those chemicals. All right. Now, some of the diseases that you see, so we've obviously talked about stroke, we've talked about heart disease, but popcorn lung is something. What is popcorn lung?
So popcorn lung is bronchiolitis, and it's one of the effects of smoking. You can get it from smoking and e-cigarettes and e-learning. The vaping. So it's your lungs, literally, if they were to do an x-ray of your lungs, it's going to look like popcorn in there because you've damaged the alveoli, the airways of the lung. And that's what happens. They just start kind of like popping up.
And then there is vaping-related lipoid pneumonia. What is that? Oh, I'm stumping you now.
Oh, you got me on that one.
But it's basically you're getting pneumonia that's caused by the vaping.
By the vaping, right. It's a pneumonia caused by the vaping. It's not by an infection or a virus or any of that type. It's by the vaping, like I had explained earlier. When they do the bronchoscopies, they go in and try to get tissue to see what's causing the pneumonia or the possible infection. They're finding that there's nothing causing it, but it was caused by the vaping.
You can also experience collapsed lung.
Yes. And that could be caused by coughing, you're just a weakened system, your system itself. A lot of times when we cough, some people are just if they cough wrong, they'll have a pneumothorax or a collapsed lung. So yes, it can happen.
All right.
Forcefully coughing and so forth.
So it's really important to be paying attention to sort of the initial symptoms that we talked about earlier, because any of those things can lead, if you're not treating them, if you're not taking care of it, or if you're continuing to do something bad, it's going to only get progressively worse.
Correct. It will get worse as time goes on.
And it'll lead to that popcorn lung or the collapsed lung or any of those issues that we see. Now, we talk about secondhand smoke when it comes to cigarettes. It's the same with the vaping, right?
Yes, it is.
Secondhand smoke, just being around people who are vaping can still be dangerous.
Yes, it can be.
And why is that so important to remember, that you got to tell your friends?
Do not vape in front of me or smoke in front of me, because it's going to affect me just as much as it's going to affect you.
Now, that aerosol contains, once again, those harmful chemicals. They're potentially harmful substances, including cancer-causing chemicals, and those tiny particles can be inhaled deep into the lungs.
Yes.
So they're the minute like chemicals, and those particles are coming into our lungs.
Correct.
And you just really don't realize just how dangerous that is.
Yes, it's
Now,
very dangerous.
here are some facts that we have to really remember. Vaping, this is a myth that they say that vaping is less harmful than smoking, but it's still not safe. So that's something we have to remember, that yes, it's not as bad as smoking, but it's still bad.
You're right. It's just as bad, and like we spoke earlier, it's that there's not enough studies out there to show that it's just as bad, because it's just something relatively new, and there's not enough data to support it.
But I mean, I want to say that in 10 years from now, you're going to have research that's just going to show, just as smoking, initially people thought it was the cool thing to do. It was in movies. You saw, leading men smoking a cigarette up against a wall, and now you don't see that as often because people have come to realize that. So in 10 years, I think people are going to see, you know what, vaping is just as bad.
Yeah, like I said, once they get all the data and they start, and as we speak more about it, of the dangers of it, I think it's going to help on curtailing the process of people doing the vaping and the e-cigarettes. It's more about teaching and being out there and vocal about it, not to do it.
Now, research suggests that vaping is bad for your heart, not just your lungs. So your heart is also impacted, just the same way as smoking is.
It impacts the same way. So even though you vape or e-cigarettes, just think of it, you're smoking, and it's going to affect any part of your body. Your circulation to your legs, to your heart, to your brain, to your lungs, you're going to start losing some circulation to that effect.
Now, electronic cigarettes are just as addictive as traditional ones. So don't be fooled.
Correct.
They are still addictive, and you got to make sure that you know that, and that your children know that. If you're a parent, that you're making sure that you're telling your kids just how dangerous it is. Now, electronic cigarettes aren't the best smoking cessation tool. So some people will say, I want to quit smoking, so maybe I'll switch to a vape because it's going to help me, cut off the smoking. But it's not the best tool. There are other ways to quit smoking.
A lot of people will go into other ways. Some people will go into meditation, yoga classes, exercising, and some will just turn to maybe put a toothpick in their mouth as a habit, start eating a candy, chewing gum. There's various ways of doing it.
And the biggest fact that we're finding is that a new generation is getting hooked on nicotine. Unfortunately, those numbers are startling to see just how many more people are vaping, and at a younger age. Yes,
it is alarming. And again, I believe because people think it's the cool thing to do, the young generation think it's just the coolest thing to do, and they talk about it. So why not? My friend does it, so let me do it. It's cool.
All right.
So that's what's increasing the numbers, I believe.
Now, it's important to really realize the dangers of vaping. So we're going to go over some of the major issues that can happen. So these are problems caused by vaping. So there's asthma. You're more likely to get asthma and other lung conditions, or it will make your asthma worse.
Correct. It will exacerbate your asthma.
Are you seeing that with any of those kids that have come in where their asthma is just a lot worse? They're getting more attacks?
Right, because they already have a lung issue. So all they're doing is exacerbating that by smoking or vaping. It's just kind of manifesting the asthma a little bit more. And those asthma attacks can get pretty serious.
You're seeing lung scarring, so that is causing that, again, that popcorn lung. You're starting to see that permanent scarring in your lungs.
Correct.
And once it's there,
It's there. You can't get
It's
rid
there
of it.
forever. You're getting organ damage. So in addition to your lungs, the nicotine and other substances and the e-liquid can hurt your heart and your brain. So it's really important to understand that it's not just impacting your lungs, it's your entire body.
Correct.
And then there were cases of EVALI, which is e-cigarette or vaping product use associated lung injury. So a really serious lung condition that people are experiencing with widespread damage to the lungs.
Right. There is a lot of people that are experiencing that now. It's because of all of the chemicals that you're ingesting into your lungs.
Mm-hmm.
It's causing that.
All right. And then lastly, addiction. Obviously, we know that nicotine is addictive. We can't stress it enough. I think there's just that misconception that, oh, I'm just going to do it for a little bit or whatever. But just a few of those puffs down the road may become
lead up
addictive.
to more, yes.
Mm-hmm. So just stay away from the vapes, stay away from the e-cigarettes, and stay away from cigarettes. It's just the best advice that you can have. So let's talk a little bit about quitting vaping. So what are things you do? You mentioned making a goal, setting a quit date, doing something that you can do to, like, you know what, today's the day. Today's the day.
And also you have a very good support group that's going to help you along the way. It's always important to have somebody that's going to support you and help you through this transition. Because I'm sure that when you're going through that transition, you're going to have a lot of emotions and stuff. You know, we see people who have tried to quit smoking or have quit, and they just go, you know, they get a little bit more tense because they're looking for something, just like an alcoholic or any drug addict. It's the same thing. You're going to see them kind of get just like they need it, they want it, and so they're going to do it. You know, some people will just go crazy, literally.
Yep. Now talk to a healthcare provider, a therapist, or a school counselor about quitting. They can help you make a plan that works for you and give you support in the process. So talking to an expert is going to really help you kind of,
correct.
It's always good to get their opinion, their support, and their encouragement, and a plan that they can help you with to get you there.
Right, and I believe there's some 1-800 numbers for smoking cessations and so forth that you can reach out to.
And you can ask your provider, therapist, or school counselor for free resources to help you quit, like online texting and phone services or apps. And there are a lot of them. If you look up smoking cessation and vaping cessation online, you'll be able to find a lot of them. Now let your friends and family know your plans for quitting. They can give you that support you need. As you said, that support system is important, but you almost have to declare it to everyone and say, I'm trying to quit. If you see me with a vape, if you see me reaching for it, make sure to tell me to stop.
Correct. Stop or tell me, you know, try something else. Let's go do something else at that time so that you can just get your mind off of it.
And then make a list of reasons you want to quit vaping. Look at it or think of it throughout the process of quitting. So all of the reasons why you want to quit. So I want to lead a healthy life. I want to be able to see, you know, to have children and grandchildren one day and see them, you know, see them get married and grow up, right? So things like that. So making that list of why you want to quit. Right. I want to be the star football player. You know, you're not going to be with bad lungs. You're not going to be able to
You're not going to be able to do any sport with bad lungs at all. You won't be able to do any running. You may run, but you won't be at your 100% doing that.
Now avoid temptations and triggers. So this is always when we're dealing with any sort of addiction, you don't want to be in a room with everyone else is vaping. If you know that that's your trigger, that's an issue, don't do that. If you know that there's a stress before a test, you need to find a healthy outlet. Whatever that trigger is, you need to just avoid it, or or find a healthier outlet.
Find an outlet. Just a lot of times, just maybe exercising might help you out by doing so.
And then, so one of the biggest things that you can do, and it's not only a great way to stop and distract you, but it's also really healthy, is exercise. So just going out there, going for a walk, going for a run, doing any different sport or activity is going to help get your mind off of that.
Correct.
And those endorphins will also help keep you happy and healthy.
And healthy.
So that's really important. And lastly, learn to relax. So yoga, meditation, those sort of activities can just sort of help you, especially if you feel like your stress, or your child is somebody who's always striving for that A and they're stressing themselves out. Teaching them how to relax.
Relax and just take it easy. It's going to happen. Just take some deep breaths.
All right, so let's talk about parents and helping them when it comes to talking to your kids about the dangers of vaping. You want to look out for those warning signs. And so these are some of the things that you need to be looking out for. Changes in emotions or new behaviors like secrecy. So if they're a little bit secretive, all of a sudden you're not seeing them, or they're sneaking away and they're coming back 5-10 minutes later. Those are some telltale signs.
Yes.
And we were kids, so we know when we were up to no good what we were trying to do. So that look for that secrecy that you may see, like, you know what, they were always in the living room, and now they're kind of sneaking away every now and then. So they could have a secret boyfriend or girlfriend, or they could be vaping. So either way, you just got to make sure that you're alert. Now, a dry cough or wheezing, those are a telltale sign that you're dealing with lung issues.
Probably the best one is the dry cough or the dryness in the mouth. You know, they're complaining of that for some reason or other. That's going to be one of the major signs.
Now you're doing their laundry, so you're going to make sure that you're paying attention to scents of fruity odors onto the skin, on the breath, or on clothes. So when you're around them, if you start feeling like you're like, this isn't Hubba Bubba, what is this? Like, are you chewing a lot of gum, or wait a minute, is there something else that's happening here? So anything that's a little fruity, especially with all those flavors that the kids like.
Right.
Now, strange cylinders, chargers, or batteries lying around. So if you're something, especially when you're older, you don't realize all this new technology is happening, but if there's things that just look a little odd, like you're not used to seeing around the house.
That's one of the signs also.
And then trouble sleeping. Smoking, vaping can lead to sleeping troubles, right?
Right, because of the circulation. Again, you're probably having problems breathing. You're not realizing what's going on. You're trying to catch your breath. You can't relax because you may need to have that nicotine fix, or the fruity fix, or the vaping. You know, you feel that you can't do it, so you can't sleep. So you're just tossing and turning and getting not comfortable at all.
So how do you treat respiratory issues caused by vaping and smoking? How do you sort of approach a patient? Obviously, I assume you look at the severity of their case and then determine what you're going to need to do, what steps you'll need for the treatment plan.
And basically, that's what we would do, is see how severe it is, and then we would get with the providers to see what's the best way to treat. Usually we treat somebody with any kind of lung issues would be with oxygen and or nebulized treatments.
And that nebulizer is something that I believe you can find them at any pharmacy, basically, the nebulizers.
Correct.
People use them when they have allergies or those kind of issues, or respiratory issues. But that's something that you're going to have to be treating. But I think when you're seeing them in your setting, in the hospital setting, those cases are more severe.
Yeah, the majority of the times they are very severe. A lot of them do end up on a lot of oxygen. And again, what we mean by oxygen, 2 liters is okay, but once you start going into higher levels of oxygen, because we can't get your oxygen levels up high, your saturations, what we call your oxygen saturations, that's when we start having issues and really concerned about your health. And when we have to go up higher in the oxygen, and again lead maybe into intubation and ventilation. And
intubation, I think, is something that we heard a lot more about during the pandemic, during COVID. A lot of people were being intubated, and it's a serious, very serious procedure. It's not something that, it's a simple, they're just taking the tube and they're going to take it out later. This is something that is very methodical and thought out, and you really don't want to have this done.
You do not want to have it on. You don't want to have that in you at all. They usually sedate you so you're asleep for the length of the time that you have that tube in there. It's not comfortable to have one. Even if you've had some type of maybe surgical procedure, you wake up and you have that. They've intubated you for the surgery because they had to put you to sleep, and you wake up and you've got that dryness, that your throat hurts. So imagine having a tube in your throat for 7, 10, 15 days and not being able to do anything when they remove that tube that you can't even swallow. I mean, that's very painful.
That's something right there, that if your mental note on your list of things, I do not want to be in a hospital bed for 15 days, intubated.
Intubated, not doing anything, but just laying there and having everybody do everything for you.
So we talk about, obviously, not vaping, and if you are vaping, to stop. But how else can we protect our lungs?
Just be careful where our surroundings. We're in an area where it's always windy. There's a lot of dust, so we just have to take care of ourselves that way. I just try to stay away from those areas.
And I know that we sometimes get those winds that come in from Mexico where there was a few months, or the Saharan dust, or from Mexico when they were doing the burning, that it was coming into the valley. So just making sure that if we're going to be outside, that we're paying attention to the weather report.
Correct.
To see what is the air quality at
Correct.
the time.
And if you already have a lung issue, try to stay indoors as much as you can. Try not to be outdoors. I know it kind of sounds like, oh my gosh, I have to stay inside. Well, it's better to stay inside than to go outside and have something happen to you because you can't breathe. So it's easier just to stay inside. So just like Tommy says, just watch the weather, air qualities, and take care of yourself that way. That would prevent some of the issues.
And if you're inside your house, while you're in there, you need to be paying attention to the filters.
Correct.
Because I think that's one of the things we don't think about often. You're supposed to clean those out every so often, and if you're not doing that, those particles are staying in the air. They're not being taken out.
Right. So you want to change your air conditioner filters, I guess, every 30 days or so. 25 to 30 days is what most companies recommend.
Now, are there any exercises that you recommend when it comes to improving our lung health?
You just want to do some slow, deep breathing a few times a day. Just kind of sit, relax. Just like I said, take some deep breaths, hold it a couple of seconds, and then exhale. And you might want to do that 10 times, maybe every 2 or 3 hours if you're at home. Or if you have time at work or school, you can do the same thing just to kind of exercise those lungs and expand them.
One of the exercises that I learned from one of your awesome team members when we were talking about respiratory therapy was breathing in for 4 seconds, holding it for 4 seconds, and releasing for 4 seconds.
Correct.
And since I have to do a lot of talking for this job, I definitely will do that to just make sure that I have strong lungs when I'm reading a script or when I'm speaking. So it's an easy exercise that you can do that. It's very relaxing. If you're stressed about a test, if your child is stressed, teaching them these exercises will help them sort of relax.
Yeah, it'll relax them.
And it'll not only help improve your lung health, but it will most certainly, hopefully, be enough to beat the stress that you won't want to reach for a vape.
That's correct.
All right. And now for resources for quitting when it comes to vaping or smoking, you can call 1-800-QUIT-NOW. That is 1-800-784-8669. So 1-800-QUIT-NOW. You can text QUIT NOW to 333-888. That's QUIT NOW. You're going to text that to 333-888, or you can visit the CDC website. There are a lot of resources that are available there. Obviously, you want to go to a reputable website to make sure you're not just paying attention to TikTok. You want to make sure that you're going to the CDC website, Mayo Clinic, Cleveland Clinic, those sorts of websites that are reputable and that are going to have that information that you need.
Along with American Lung Association also has a website you could reach out to.
So what is your final key piece of advice that you want to give to those that are watching?
Quit smoking, no vaping, and no e-cigarettes. Keep those lungs healthy.
Keep them healthy and happy.
That's right.
All righty. Well, thank you so much, Mary. We really appreciate your time.
Thank you, Tom.
All right. And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize the health of your children, and we look forward to seeing you for our next installment of this Let's Talk Children's Health series on Wednesday, November 20th from 5:30 to 6:30 p.m. when we'll be talking about car seat safety. Like and follow the STHS Children's Facebook page for more details on our future Let's Talk Children's Health webinars. And to see all our previous Let's Talk seminars, all you have to do is visit STHSLetstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health and the health of your little ones.
At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.